covering the basics, that is the HAP and pathophysiology from your SEM 1 and SEM 2. So let's discuss about what is to be done, what is to be prioritized from these two subjects. So firstly, you need to know the basics of these systems, the organs that are associated with this system, and the major function. Like in reproductive, what are the male reproductive and female reproductive organs, the glands, seminal vesicle glands, corpus glands, etc. Endocrine system, you need to know the types of endocrine glands, the anatomy, like which is a butterfly shaped gland, which is a pea shaped gland, which is the largest gland, which is the master endocrine gland. Then in CVS system, you need to know the pacemaker, how does it work, the conducting system of the heart, the cardiac cycle, everything is to be studied, the double circulation. In central nervous system, basically you need to know about the all the nerves, cranial nerves, spinal nerves, and then because questions are asked on in cranial nerves and on spinal nerves. Next up, you need to see about the digestive and respiratory system. So in respiratory, the mechanism of respiration, the difference between internal and external respiration. In digestive system, basically we need to know about the different acid production pathways, the different like the organs and the functions, the glands that secrete certain juices, digestive juices, the pH of salivary amylase, and what does it convert like starch into maltose, like its function. Next up, you need to know certain terminologies of pathophysiology like apoptosis and necrosis. So which one is caspase dependent, which one is caspase independent, which is a programmed cell death, which is a non-programmed cell death. Then you need to know about the common mediators. So there are certain common inflammatory mediators like prostaglandins, thromboxanes, leukotrienes, interleukins, cytokines. So you need to know that categories like which one belongs to the amines like histamine and serotonin, which one belongs to the lipids, prostaglandin and thromboxanes, which one belongs to the amino acid category like bradykinin and caladin. So you need to know angiotensin. So you need to know the different inflammatory mediators and the types like prostaglandin E, F, I. So that E stands for ether solubility. So you need to know every small detail of these mediators, like its function, the drugs that act on these mediators. Next comes certain technical terms and terminologies like diapedesis, pavementing, margination, cementing. Directly questions are asked that if there is movement of WBC amoeboid in an amoeboid cell like, so what is it? So you need to know that it is diapedesis. So these are certain terminologies that needs to be well versed. Next up on priorities to be done is the normal levels. So you need to know the normal blood glucose level, the normal heart rate, the systolic diastolic pressure, the pulse rate, the blood cholesterol, the blood creatinine level. So all these normal RBCs, WBCs, hemoglobin, hematocrit, these are certain normal values that you need to know at least the basics. Like if it's blood glucose, so postprandial, this is the value. Preprandial, this is the that is before food and after food. Ideally, it is 70 to 120 milligram per dl. So you need to know this. Genetics. Speaking about genetics, the central dogma, transcription, translation, the semi-conservative replication of DNA. So different, many times this is a favorite question of examiner. So keep this on a major priority. Genetics. So chromosomes and everything that genetic disorders are asked very often. Next up, we have special senses like the tongue, the ears, the eyes. So you need to know the internal ear, external ear, middle ear, the organs. In eyes, you need to know rods, cones, which one is for dim light, which one is for light vision. So that is important. Like retinol is a vitamin that is very essential. Otherwise, there might be night blindness in its deficiency. Also, there is color blindness. You cannot differentiate between red and green. So skeletal system mein you need to know the joints especially, and ligaments, tendons, the axial appendicular classification, like all that you did in 12th 11th standard and in the first year of pharmacy. So that is to be done. Next up, we have how do we categorize it into phases, how do we complete this one subject into phases. So in phase 1, you need to know the basics of all the system, that is very essential. After knowing the basics like the organs and the major function, the location, or if there is any particular peculiarity of that particular organ. In the phase 2, you need to know the normal range of vitals and on the different or different biological elements or substances, like there are HDL, LDL, VLDL, triglycerides, etc. And in phase 3, finally, you need to revise Ross and Wilson and NCRT. So if you get time, this, because this is a minor subject, you don't need to devote much time, let me be very honest. So just give some of the time for revision of Ross and Wilson, and that will be suffice. So that's all for today's video. I hope you did all enjoy and gained a lot of knowledge. So let's meet in the next session, part 9. Till then, if you have any queries or doubts, feel free to drop them in the comment section. Thank you so much, everybody.